Ever wonder what keeps your body running smoothly, kind of like a perfectly tuned orchestra?
Hmm.
Imagine different sections, your glands, each playing its instrument, the hormones.
Right.
And just like an orchestra needs conductors, your body has the hypothalamus and pituitary gland making sure everything, stays in harmony.
That's a really great analogy, actually.
Today we're going to explore what happens when this incredible endocrine system gets a little off-key. We're doing a deep dive into some key endocrine disorders, the kind of things you might encounter when studying how the body works.
Yeah, absolutely. And at the heart of this hormonal harmony is the hypothalamus-pituitary hormone axis.
Okay.
Think of your hypothalamus as the control center, right?
Hmm.
It sends out signals to the pituitary gland, that's the main conductor, which then releases its own hormones.
Got it.
And these travel to other glands like the thyroid and adrenals, basically cueing them to produce their specific hormones. It's a pretty fascinating chain of command.
Okay, so how does this command center know when to, like, crank up the volume on one hormone and maybe quiet another one down?
That's where feedback mechanisms come in. And the most common one is negative feedback.
Negative feedback,
Yeah.
like a thermostat.
Exactly like a thermostat regulating temperature. When a hormone level in your blood gets too high, it essentially sends a signal back up the chain to the hypothalamus and pituitary, telling them, okay, ease off on the stimulating signals.
Hmm,
Take thyroid hormone, for instance. When its levels are high, it tells the pituitary, hey, release less TSH, which is thyroid stimulating hormone.
right.
So less TSH means the thyroid gets less of a nudge and it produces less thyroid hormone. It's a really brilliant self-regulating system.
Wow, yeah. The pituitary gland sounds like a real powerhouse then. I understand it has, like, two main parts that do different things.
Precisely. You've got the anterior pituitary, which is a true hormone factory. It synthesizes and releases a whole lineup of hormones. These include ACTH, which directs the adrenal cortex to produce cortisol. You can think of cortisol as the body's stress manager.
What?
Then there's TSH, which we just talked about, stimulating the thyroid to make those metabolic hormones, T3 and T4.
Right.
We also have GH, growth hormone, crucial for development. FSH and LH, key players in reproduction. And prolactin, which is responsible for milk production.
Hmm.
The anterior pituitary really has a lot on its plate.
It really does. And the posterior pituitary. Is it also making its own hormones?
Interestingly, no. The posterior pituitary acts more like a storage and delivery hub
Oh, okay.
for hormones that are actually produced up in the hypothalamus.
Mhm.
The two main ones are ADH, antidiuretic hormone, which is vital for managing our water balance. It acts on the kidneys.
Right, water balance.
And oxytocin, which is, famous for its role in uterine contractions during childbirth and also milk release.
So we've got the signals, the messengers, the targets, all working together. But what happens when this communication system, malfunctions? You mentioned things going too hot, hyperfunction or too low hypofunction.
Exactly. Hyperfunction means a gland is producing way too much of a hormone,
Okay.
while hypofunction means it's not producing enough. And we're going to explore some specific examples of these imbalances affecting the pituitary, the thyroid, and the adrenal glands.
Right.
We'll look at what happens in the body when these hormone levels are off, the sort of telltale signs and symptoms that pop up, and how doctors diagnose and manage these conditions. Our aim is really to give you a clear picture of these endocrine hiccups without getting too bogged down in, overly technical jargon.
Sounds like a solid plan.
Yeah.
Let's start back with that conductor, the pituitary gland. What kind of problems can actually arise there?
Well, the pituitary itself can definitely experience issues. On the hyperfunction side, so too much hormone, we see conditions like acromegaly.
Acromegaly.
Yeah, which
Yeah.
is caused by an overproduction of growth hormone, GH, but specifically in adults.
Acromegaly, the name itself sort of suggests something enlarged, doesn't it?
Yeah.
What are the key things someone might notice?
That's right. That sustained excess of growth hormone leads to a really distinctive set of physical changes. People with acromegaly often notice their hands and feet getting larger, their facial features becoming more pronounced, especially the jaw, maybe their forehead, and their voice often deepens too. And sometimes there can also be issues with other organs because of this prolonged exposure to high GH levels.
That's quite a spectrum of effects. What's another example of the pituitary being sort of overactive?
Another really significant one is SIADH. That stands for Syndrome of Inappropriate Antidiuretic Hormone Secretion.
SIADH, okay.
In this condition, there's an excessive release of ADH, that hormone that regulates water balance.
And too much ADH means the body holds on to too much water, right? That makes sense.
Precisely. And this excess water retention can actually dilute the sodium in the blood. leading to a condition called hyponatremia or low sodium. And that can disrupt various bodily functions, including brain function. So, yeah, water retention and low sodium are the primary concerns with SIADH.
Okay, so that's the pituitary in overdrive.
Yeah.
What about when it's not producing enough hormones, the hypofunction side?
Right. On the hypofunction side, we have something called pituitary dwarfism. This results from a deficiency in growth hormone, GH, typically occurring during childhood.
Okay.
The most apparent sign, well, as the name suggests, is significantly shorter stature than expected for their age.
And we also mentioned deficiency in ADH earlier. What happens then if there's not enough ADH?
An ADH deficiency leads to diabetes insipidus. Now, this sounds like diabetes mellitus, but it's totally different.
Right. Important distinction.
Yeah. Here, because there's not enough ADH, the kidneys aren't able to properly retain water. This leads to a classic trio of symptoms. Polyuria, which means excessive urination.
Okay.
Polydipsia, which is extreme thirst.
Constantly thirsty.
Exactly. And if fluid intake doesn't keep pace with those losses, it can result in dehydration. So while SIADH is about holding on to too much water, diabetes insipidus is all about losing too much.
That makes the contrast really clear.
Wow.
So how do doctors actually, diagnose these pituitary issues? What tests do they run?
Well, there are several important lab tests. Directly measuring the levels of pituitary hormones like GH and ADH is obviously key.
Makes sense.
For acromegaly, we often look at IGF-1, that's insulin-like growth factor 1. Its levels tend to be consistently elevated in response to high GH, making it a reliable marker.
Oh, okay. IGF-1.
And imaging, especially an MRI of the pituitary gland, can be really helpful. It can show if there's a tumor or some other structural abnormality that might be causing the hormonal imbalance.
Right. Looking for the cause. And once a pituitary disorder is identified, what are the general treatment strategies? Like, what do you do about it?
It depends on whether it's hyper or hypofunction. For hyperfunction, if a tumor is the cause, surgery to remove it is often the first step. There are also medications that can be used to suppress the overproduction of specific hormones.
And for hypofunction, not enough hormone.
For hypofunction, the main strategy is hormone replacement therapy. Pretty logical. For GH deficiency, this means regular GH injections.
Right.
And for ADH deficiency and diabetes insipidus, there's a synthetic form of ADH called desmopressin, or DDAVP. It's commonly used to help the kidneys conserve water.
Okay, we've explored the control center, the pituitary. Now let's move down the chain a bit to the thyroid gland in the neck. What kind of imbalances can happen there?
Yeah, the thyroid gland can also experience both hyper and hypofunction. Hyperfunction of the thyroid is called hyperthyroidism.
Hyperthyroidism.
And a really common cause is an autoimmune condition called Graves' disease. Think of hyperthyroidism as your body's engine just revving way too high. We sometimes use the analogy crazy, bouncing around, heart fast, anxious, high metabolism.
Crazy, bouncing around. Wow, I can almost feel my heart rate increasing just thinking about it. What are the actual signs someone might experience with that?
Well, that revved up metabolism translates into things like unexpected weight loss, even if you're eating normally or even more. Feeling constantly hot or having heat intolerant, like you just can't stand warm temperatures.
Yeah.
A rapid heartbeat or palpitations, that's tachycardia, and often feelings of nervousness, anxiety, and irritability, sometimes even tremors.
That paints a really vivid picture. Okay, and then on the other end of the spectrum, we have hypothyroidism. What's the analogy there? Everything's slowing down.
Exactly. For hypothyroidism, picture everything slowing right down. Slow, sluggish, gaining weight, slow heart, depressed. This reflects a metabolism that's running on low power.
So essentially the opposite of what happens in hyperthyroidism then.
Pretty much the exact opposite, yeah. Hypothyroidism can lead to unexplained weight gain, even with a normal diet.
Right.
A constant feeling of being cold or cold intolerance. A slower than normal heart rate, which is bradycardia. Persistent fatigue is a big one. And even symptoms of depression or just feeling mentally foggy. And Hashimoto's thyroiditis, another autoimmune condition where the body mistakenly attacks the thyroid gland, is a very frequent cause of hypothyroidism.
Hashimoto's. Okay. So how do doctors go about testing for these thyroid problems?
The key lab tests for thyroid disorders involve measuring the level of TSH. Remember, that's the stimulating hormone from the pituitary.
Right, the signal.
Exactly. And also measuring the actual thyroid hormones, free T3 and free T4, in the blood. Plus, checking for specific thyroid antibodies can be really helpful in diagnosing those autoimmune conditions like Graves' disease and Hashimoto's.
Got it. And what are the treatment options when the thyroid does get out of whack like this?
Okay, so for hyperthyroidism, the goal is basically to reduce the production of thyroid hormones.
Makes sense.
This can be done with antithyroid medications. Another option is radioactive iodine therapy, which selectively destroys the overactive thyroid tissue.
Hmm.
Or, in some cases, surgery might be needed to remove part or all of the thyroid gland.
And for hypothyroidism, where there's not enough hormone.
That one's more straightforward generally.
Mm-hmm.
The primary treatment is thyroid hormone replacement therapy. Usually, this is with a synthetic form of T4 called levothyroxine. It essentially gives the body the thyroid hormone it's missing.
Levothyroxine, right.
Okay.
Okay, we're moving further down the line now to the adrenal glands, those little glands on top of the kidneys. What kind of disorders can pop up there?
Right, the adrenal glands. They primarily produce hormones like cortisol, the stress hormone, and aldosterone, which helps with salt and water balance. Hyperfunction of the adrenal cortex can lead to Cushing syndrome.
Cushing's?
Yeah, which is characterized by chronically high levels of cortisol. You sometimes hear mnemonics mentioned for the symptoms, but the key signs include a rounded face, often called a moon face,
Moon face, okay.
a collection of fat at the back of the neck, known as a buffalo hump,
Right.
increased fat deposition, mainly in the central part of the body, so the trunk, with relatively thinner arms and legs, that's central obesity, and also elevated blood sugar levels, hyperglycemia.
That's a pretty recognizable set of features when you put them all together. Are there other conditions where the adrenals produce too much hormone?
Yes, another hyperfunction disorder is called Conn's syndrome. This involves the overproduction of aldosterone.
Aldosterone, that affects blood pressure, right?
Exactly. It helps regulate blood pressure and electrolyte balance, particularly sodium and potassium. So too much can cause high blood pressure and low potassium.
Okay. And what happens when the adrenal glands don't produce enough of these crucial hormones? Hypofunction.
Hypofunction of the adrenal glands leads to Addison's disease. This is where there are insufficient levels of both cortisol and usually aldosterone as well.
Addison's disease, what does that look like?
The main symptoms include pretty persistent fatigue, unintentional weight loss, low blood pressure or hypotension, and a really distinctive hyperpigmentation or darkening of the skin. It's often noticeable in skin folds, creases like on the palms, and even on scars. Sometimes the gums, too.
Wow, darkening skin. That's quite specific. How are these adrenal disorders typically diagnosed then?
Well, key lab tests include measuring baseline serum cortisol levels, often early in the morning when they should be highest.
Okay.
Also, performing an ACTH stimulation test. This checks how well the adrenal glands respond when given ACTH from the pituitary.
Testing the response.
Exactly. And measuring aldosterone levels along with plasma renin activity that helps evaluate the whole system regulating blood pressure. And just circling back quickly to ADH issues for a sec.
Yeah.
Remember those clues? In SIADH, you'd expect to see low serum sodium and concentrated urine because the body's holding water.
Right.
Whereas in diabetes insipidus, it's the opposite, high serum sodium and really dilute urine because the body's losing too much water. Sometimes these electrolyte clues can point towards a broader endocrine picture.
That's a good connection to make. And what are the treatments for problems with the adrenal glands? For Cushing's and Addison's?
Right. For Cushing syndrome, if it's caused by an adrenal tumor, surgical removal of the tumor is often the way to go. There are also medications that can inhibit cortisol production. For Addison's disease, because the problem is a deficiency, the treatment involves lifelong hormone replacement.
Lifelong. Okay.
Typically, yeah. This usually includes corticosteroids like hydrocortisone to replace the missing cortisol, and often mineralocorticoids like fludrocortisone to replace the aldosterone.
We've covered a lot of ground here and a lot of different conditions. You mentioned some helpful mnemonics earlier to help keep these straight. Can we recap those quickly?
Absolutely. They can be useful. To help recall some of the hyperfunction disorders, the too much conditions, there's that saying, go crazy shooting cortisol.
Go crazy shooting cortisol. Okay, break that down.
Sure. Go reminds us of GH excess and acromegaly.
Got it.
Crazy can link to Graves' disease and hyperthyroidism, that revved up state. Shooting can represent SIADH. Think of ADH being shot out inappropriately.
Okay, clever.
And cortisol obviously points to Cushing syndrome, the high cortisol state.
That's a really neat way to link them. What about the hypofunction disorders, the two little ones?
For hyperfunction, we have down hard, down cold.
Down hard, down cold.
Down hard can help you remember dwarfism, low GH, and diabetes insipidus, low ADH, think hard thirst, hard urination maybe.
Okay.
And down cold points clearly to hypothyroidism with that characteristic cold intolerance and slowed down feeling.
Nice. And you had a really simple tip for remembering Addison's disease, too.
Yeah, just a quick one. Addison needs to ADD cortisol.
Ah.
Since Addison's disease involves a deficiency, needing to add back cortisol, that can help lock it in.
These memory tools are fantastic, actually, really helpful. And to really solidify our understanding, we had some rapid-fire flashcard review questions lined up. Let's just run through those one more time. Hormone control system.
That's the hypothalamus-pituitary axis.
Okay, hormones from the anterior pituitary, the factory.
ACTH, TSH, GH, FSH, LH, and prolactin.
Right. Hormones from the posterior pituitary, the storage hub.
Adiation, oxytocin.
EH excess disorder in adults.
Acromegaly.
GH deficiency disorder in kids.
Pituitary dwarfism.
ADH excess disorder, too much water retention.
Just IDH.
ADH deficiency disorder, losing too much water.
The diabetes insipidus.
High cortisol disorder. Moon face, buffalo hump.
Cushing syndrome.
Low cortisol disorder, hyperpigmentation fatigue.
Addison's disease.
Hyperthyroidism signs. Revved up.
Weight loss. Tachycardia. Heat intolerance.
And hypothyroidism signs. Slowed down.
Weight gain. Bradycardia. Cold intolerance.
Excellent. That quick review really does help reinforce the key takeaways. It pulls it all together.
Absolutely. So as we've explored, the endocrine system truly is this marvel of balance, isn't it? With the hypothalamus and pituitary acting as those central orchestrators.
Yeah.
And disruptions in this delicate system leading to either too much or too little of specific hormones, well, they can have really wide-ranging effects on the body, each with its own set of characteristic signs, symptoms, and, thankfully, treatment approaches. It really just underscores the intricate and, frankly, fascinating nature of how our bodies communicate internally.
It really does make you think. You know, considering how interconnected everything is, the hypothalamus, the pituitary, all the other endocrine glands down the line, what kind of complexities might arise when doctors are trying to diagnose conditions where maybe multiple hormones are affected? Or perhaps where the initial symptoms are just vague and don't clearly point to one single gland?
That's a great point.
It really highlights that the body isn't just a collection of separate parts, is it? It's a truly integrated system.
Exactly. It absolutely is. And understanding these fundamental principles, hopefully, like we've discussed today, gives us and gives you listening a really crucial framework, not just for appreciating the normal, amazing functioning of our bodies, but also for comprehending what can happen when the delicate balance of this hormonal symphony gets disrupted.